Start with a story. Back in 2017, what feels like ages ago now, my sister was pregnant with her first child, and I was in grad school getting my master's in public health and social work. So during this time, I was learning all about health equity from an academic standpoint, and unfortunately had to witness some of those inequities in my personal life as well. So in school, we were taught about health disparities and birth outcomes. So that means that about 16% of infants born to Black women are premature compared to 10% among white women. Also that Black babies are almost twice as likely to die before their first birthday than white infants, and that Black women are 4 times more likely to die from pregnancy-related complications. So I'm learning about all this and learning that the disparities hold, some of the disparities hold regardless of socioeconomic or educational status, and that the root cause is really racism and the toxic stress that comes from it all. And as a Black woman, that scared me and made me upset personally, but then also my sister's pregnant during this time, as I mentioned, and she goes into labor about 6 weeks early. So I'm there in the delivery room supporting her, and really the whole time she's stressing and scared and nervous because she doesn't know how healthy her baby is going to be because she's 6 weeks early. And she asks, why is this happening to me? And my initial reaction was, because you're a Black woman. And it's not her Blackness that inherently makes her more predisposed to giving birth early. It's all the circumstances and societal structures that are leading to more Black women having poor birth outcomes. There are many different definitions of health equity, but the one that strikes me most is from the Robert Wood Johnson Foundation. And it means that everyone has a fair and just opportunity to be as healthy as possible. This requires removing obstacles to health, such as poverty, discrimination, and their consequences, including powerlessness and lack of access to good jobs with fair pay, quality education, and housing, safe environments, and healthcare.
For me, health equity really doesn't only refer to medical care. It really ties into broader issues that underlie public health, such as access to housing, to quality education, and to other social services. So one of my major roles during the COVID-19 pandemic has been to serve on the Pennsylvania COVID-19 Health Equity Response Team, which was organized by the Pennsylvania Department of Health. In general, I think that a lot of the injustices during the COVID-19 pandemic weren't really new, but that they were mostly caused by pre-existing problems and disparities that are baked into our healthcare, and our social service systems, and our society at large. Most of the concerns we heard from communities were related to things like struggling to find new health insurance, the high cost of medical care, limited ability to get to testing sites because they didn't have access to transportation, being afraid about evictions, food insecurity, language barriers. These are all things that were very familiar to me in all my time working in public health, and it was completely unsurprising that those who suffered the most during the pandemic were the communities who have always been discriminated against and marginalized.
So also social determinants of health play a large role in health inequities, and social determinants of health are those kind of non-medical factors that influence health outcomes. They're the conditions in which people are born, grow, work, live, and age, and the wider set of forces and systems that shape our daily lives. So these forces and systems include structural racism, economic policies, and social norms.
And what we know from research is that up to 80% of a person's health is determined by these factors. So we're not talking about health insurance, we're not talking about the quality of care you receive in the hospital or in the doctor's office. These are just the pieces of your built environment that you interact with every single day that are creating up to 80% of an individual's health. And what we know is that low-income folks, ethnic minorities, folks who are marginalized, like the LGBTQ community, these groups are experiencing social need at disproportionately high rates, and that the social determinants of health are making their health worse.
Priorities and strategies for achieving health equity are not static, but rather change in response to shifting community conditions and engagement of new voices. 2020 was a year of incredible loss and challenge. At the same time, it was a year in which young people made their voices heard in a variety of ways, including through movements of racial equity and against structural racism and injustice. We need and welcome your continued participation in both dialogue and action to make progress. What was important or worked for my generation may not work or matter for yours. What people with privilege and resources think matters the most may not reflect everyone's reality or lived experience. Here, I want to underscore that equity is not the same as equality. Equality means each individual or group of people is given the same resources or opportunities. Equity recognizes that each person has different circumstances and allocates the resources and opportunities needed to reach an equal outcome.
I want to kind of highlight one very important thing, and that's that policy change doesn't happen because of bureaucrats. It doesn't happen because of politicians. It doesn't happen because of technocrats. It happens because of movements. It happens when young people come together and decide that they've had enough, that enough is enough, and they're ready to create the change that they want to see in the world. And so my hope is that all of you kind of coming together to think about health equity, to learn more about health equity, to bond in your interest in this really important topic, will come out of this with some concrete steps for how you are going to go about addressing the social determinants of health, addressing social need, and building a healthier and better world where people could live with the dignity that all of us deserve.